Hi, everybody. My name is Moh Noori, and I'm the founder and CEO of ScriptChain Health. At ScriptChain Health, we use artificial intelligence to predict heart disease readmissions, and we give physicians a second opinion on personalized treatment options to combat over and under treatment. I want to walk you guys through why I started the company in the first place, right? So when my mom gave birth to my sister and I within a year time frame, she needed assistance taking care of me while she tended to my sister. So my grandma actually stepped in and started taking care of me as I was growing up. And over the years, I became very close with her. So close that I consider myself to be a grandma's boy, very proudly. But unfortunately, she was actually diagnosed with CHF, so heart failure. And over the years, her symptoms and her severity level started to increase. And she was always going in and out of the hospital, in and back readmitted into the hospital over and over again, where I thought that physicians were treating her kind of like a guinea pig, because they continued to remove drugs, add more, increase some doses, lower others, and it was ultimately ineffective because when I was getting ready for school one early in the morning, we received a phone call that she passed away due to CHF, and that was the first time I've ever felt heartbreak before, and I started to question the healthcare system a lot as to why weren't they able to intervene at an earlier stage, why weren't they able to prevent this, things of that sort. So fast forward to me getting into business school, I thought about that use case again, but this time I did my due diligence, right? So I wanted to figure out how large of a problem is this, and I found out that cardiovascular disease is actually the #1 cause of death in the United States, equating to over 700,000 deaths a year, and that energy continues to grow by about 2 to 4% annually. It's also the #1 cause of death globally as well, equating to over 18.5 million deaths a year. Readmission is a very large problem here in the United States. Healthcare system that equates to over $72 million a day in penalties and losses. So I thought about it, and actually Microsoft published an article last year, some of you may have read it, that's saying that 97% of patient medical data in these data EHR systems are untapped. And what is a very strong solution to that? Artificial intelligence. We're able to utilize that advanced technology in order to make these predictions as well as giving actionable advice. And that's what we did, right? As you guys can see here, we're an application located within the EHR system. We do integrate directly into Epic, Cerner, things of that sort. And ultimately, this is what the My Patient profile page looks like. Not only do we make the predictions within 30 days, which is 64% here for heart failure, but we also give, as a lower hanging fruit right now for phase 1 of our product, a drug and dose recommendation specifically personalized for that specific patient's medical history. Now, what that does is that helps lower the cost of care, improve, clinical care coordination, because if you know that a patient has 90% chance of being readmitted within 30 days versus another patient that has 5% chance of being readmitted, you're going to obviously allocate more resources towards the higher risk patient versus the lower risk patient, as well as ultimately bettering the patient experience. I mean, who wants to continue to go in and out of the hospital every single day? I'm pretty sure none of us. So I just want to kind of show you guys the economic value to our application as well. MGB is one of our partners. We've ran a pilot study at the VA hospital, and we ended up using 30% as our very conservative number benchmark as to how much we're able to improve patient quality of care and reduce readmission rate. All of this is directly from CMS, by the way, and if you can see the ROI, it's 9x return year 1 post rollout. Now, what are some opportunities? Obviously, we all know that AI is transforming almost every single industry, especially healthcare, right? Specifically in cardiology. Over 30% CAGR rate. We have a $500 billion market by 2030. And heart failure is actually top 3 most costliest readmitted conditions in the entire nation. So how does our AI work? We can't show you our architecture, of course, because that's confidential. However, I can show you some of our outcomes. So if you see here, the top 2 rows are our application, and the bottom 3 are the most used machine learning algorithms right now in the industry. And we obviously blow them out of the water. So what's our traction? You guys can see all the traction here, but one of the most important things that I want to give everybody a reminder is that we have 0 institutional backing. So we, as a company, have gained this much traction with 0 institutional backing. And for an entrepreneur, that's extremely difficult to do, especially when you have 2 LOSs by world-renowned healthcare systems. You have integrations with the big 4 EHR systems. We're working with the FDA too. We're actually going through the de novo route, which means and we've already submitted the first half of the FDA Q-Sub application, which we've already completed. We met with their FDA officers as well. Now we're moving to the second half of that entire process, and we will be the first to market to receive FDA clearance. So our business model, go-to-market strategy. Who's our customers? It's healthcare systems and health plans as well. We're a fully software-based application. So our revenue model is a SaaS, B2B SaaS business model where we have a pay per physician business model. And there's also a CPT code for implementation, guys. Super important for reimbursement.
You have 1 minute.
Okay. My background is in tech and medical devices as well. I have my MBA from Boston College, concentration in data analytics. My team, I have a stellar, exceptional team. We have top cardiologist for 6 consecutive years, Dr. Dave Denmark. We have Dr. AJ Blood, who has worked for GE Healthcare, Viz.ai, Amgen, and then AI and software engineers that have worked at Accenture, Intuitive. Our last slide here, we are raising capital for our seed round, specifically $4 million through a SAFE. That will be allocated towards R&D, regulatory expenditures, and business and marketing fee. Thank you so much.
Thank you very much, Mo. We have time for a couple of questions from the audience. Yes, please state your affiliation and your name.
I'm Dr. K.R.S. Murthy. I have many inventions in healthcare and medicine as well. I want to understand whether you do heart ejection rate analysis, which is very, very important. And I can explain to you in case you need to know what is heart ejection rate. It's basically used as in terms of percentage, 50%, 60%, 70%. Once you go below, then there are issues there in terms of pumping.
So what was the question, though? What's the ejection rate?
Heart ejection rate. It's being taken. Yeah. Do you do any heart ejection rate analysis in whatever you have done to do the learning for the AI or whatever else you use? It's a very important number.
Yeah, so how our algorithm works is that we have built out prediction models for it. Some of the inputs come from the EHR systems that have a lot to do with symptoms and whatnot. And what we've did is that we've factored out from low, moderate to high risk patients through a percentage format. And we've flagged some of the symptoms right now for phase 1. And yeah.
Any other question? If not, thank you very much, Mo, for your presentation, and good luck with your...
Thank you guys so much. I appreciate it. I'll be here all night. Thank you.